All right, residency reflection week 22. Last week was good. Had a few of my patients discharge a little earlier than I would have liked them to, but that's the way the insurance game goes sometimes. It was a good week. I got to start co-treating with another therapist kind of after I was done with my work hours for the day on a really interesting case that she has. It's a bilateral cerebellar infarcts with right cerebral multifocal infarcts, and then a history of a right frontal infarct, and then a left thalamic infarct. So a lot of different strokes going on, tons of different involvements, and he's just a really fun patient to work with. We're doing a lot of stuff in the 0G harness system, so a lot of facilitation. It takes like 3, sometimes 4 of us to walk him, kind of depending on what we're trying to focus on for that day. So he's a super fun case. I got a Guillain-Barré patient a patient with Guillain-Barré syndrome, which is pretty cool. It's not a diagnosis that is seen all the time, and it was pretty neat that I got to put that onto my caseload. Patient's awesome. They're a former surgeon, so they're very medical savvy and technical, which is kind of cool to get to kind of talk through some of what we're doing with them, and they're interested and they want to hear more, and they're making some great progress. So last week was good from a clinical perspective, and then I also got to take one of my afternoons and go to the virtual reality lab at Catholic University here in DC, which is only 20 minutes from MedStar walking, and got to talk with one of their postdoctoral researchers there about their VR system, kind of what projects he's working on, and kind of the systems that he's using in terms of VR and augmented reality, because I'm thinking about using that type of technology and systems for my research project. So it was a good week overall, kind of just cruising through some things. I'm going to start working weekends at the acute care hospital come the end of March and into April, and then kind of throughout the rest of the time I'm here at residency to try and keep growing on my experience in that area, and also just try and make a little bit of extra money. So I start trainings for it this upcoming week on all of the non-neuro stuff, so the joint stuff, vascular, cardiac, and that type of thing, just because they can't guarantee me that it'll just be neuro patients, although they'll try and prioritize me seeing those patients, which will be nice because it is kind of extra and not necessarily involved with the residency. But good week. Looking forward to this next week, starting the training with that stuff, keeping going with my patients, and seeing what it brings. So that's this week's residency reflection. Thanks for watching.